Do you want to learn how to check blood pressure, heart rate, respiratory rate, body temperature, and pain intensity? Because today, I will be demonstrating you how to check vital signs. Good day everyone, my name is Ray Carlo Linda from Mabini Gamu, Isabela, currently studying at Isabela State University, Ilagan Campus, taking Bachelor of Science in Nursing. So let's start asking, what are vital signs? Vital signs are also called cardinal signs. These are the measurements of our body's most basic functions. Originally, we have four vital signs. We have blood pressure, heart rate, respiratory rate, and body temperature. But now we have what we call the fifth vital signs, which is the pain intensity. First step, gather all the supplies and equipments needed for the demonstration. Perform hand hygiene technique with alcohol-based formulation. Why do we need na magugas ng kamay? It's because we want to prevent the spread of bacteria and viruses, and we do not want harm to our patient. According to World Health Organization, we need to follow the 5 moments of hand hygiene. Number 1, before touching the patient. Number 2, before a clean or aseptic procedure. Number 3, after a body fluid exposure. Number 4, after touching the patient. Number 5, after touching a patient's surroundings. Clean your equipments. Establish rapport to your patient or magkaroon ng ugnayan sa iyong pasyente. Just like this. So, naimbag na bigat kanya ma'am. So, siya ni Ray Carlo, ti nurse mo tata. Ti ito brand, ti tatap, tat alan, ti vital signs nyo. Okay lang ba ma'am?
Queen, sir.
So, anya tinagan mo ma'am?
Rosmeline Linda, sir.
Taga-ano ka ma'am?
Nabinigan mo.
Manutawen mo ma'am?
34, sir.
Always remember, in communicating or talking to your patient, practice establishing rapport. It is one of the most important things we need to do because we want to make sure that we have gained the trust of our patient. We want to make sure that our patient is comfortable in talking to us. It's because napapakalma natin yung patient and hindi natin ma-alter o maapektuhan yung blood pressure, heart rate, respiratory rate, body temperature. When it comes in taking vital signs naman, nakakatulong ang pag-establish ng rapport sa ating pasyente. Kasi hindi na siya kinakabahan. He or she is comfortable in talking to us na. Give your patient a 5 minutes time to rest. Remember that give your patient a 5 minutes time to rest to make sure that he or she is not running out of breath. Kasi maraming mga patient na pagod sila kapag dumating sa iyong clinic. Like for example, bumiyahe sila na malayo or di kaya yung clinic mo is located sa 5th floor. So, dyan yung rason kung bakit mapapagod yung pasyente natin. So, always give time to rest for them. Give them time to relax to ensure that the measurement is accurate when you're taking the vital signs. Start with the easiest thing to do, which is the pain rating. You might be wondering why pain is included in the vital signs. It is because normal response to pain is an increase of blood pressure, heart rate, and respiratory rate. So that means pain can alter vital signs. But since pain is subjective, we will use the numeric pain rating scale to assess the pain of the patient. So, damagat lang ma'am, no, da mararamdam mo sakit at no 0, awan ti plus maramdamam. Hanggang 10, di grabe ti sakit na ti naramdamam. So, ano ti level ti sakit nga maramdamam tatamam?
At siguro dyan number 2, sir.
Sige. So, bilang ada mariklik ng mga sakit, ma'am, mabalik mo ito doon na yan natin na sakit.
Ito na pa, sir, ni tinasakit.
So, since our patient answered 2, continue to ask open-ended questions. So, damaga lang ulit ma'am, ti mariklik na, noon nga klase ti sakit ata, no agtudok-tudok ba, no agkurkuryente, o agmagmaga.
No, kasi no, blablabanak, ajay, nasakit na wala sa spito ni, kasi la maktangan ng panayon.
Kasi ba ma'am, sige. So, as you can see, we don't use medical terms in communicating to our patient. So, kanina, nag-Ilocano ako para magkaintindihan kami. So, Ilocano yung patient ko. So, I use Ilocano for me to understand what she is saying and what I am saying. So, kapag Ilocano yung kinamit ko, accurate yung isusulat kong mga information and data. Next step is get the body temperature. So, we have different factors affecting the temperature of the body. First is time of the day, the age, the exercise, the menstrual cycle, the pregnancy, and the measurement sites. So, speaking of sites, we have different sites. We have the rectal and the tympanic membrane temperature, which gives the most accurate measurement of the normal temperature of the body, which gives 37.5 degrees Celsius. We also have the oral temperature with a normative value of 37 degrees Celsius. But now, we will use a digital thermometer to get the auxiliary temperature. So, itatamam ti alanta met kat ajay temperature mo or ajay pudot tibagin. So, first, tiba-akit, talusak ka lang atoy thermometer. In a few minutes, pwede na nating tingnan ang temperature ng pasyente. Check for the heart rate. We need to give attention to 3 things: the rate, the rhythm, and the quantity. And the normal heart rate is 60 to 100 beats per minute. So the rhythm is the pattern of the pulsation, and the interval between them can only be regular or irregular. Irregular if the pulsation is not evenly spaced. Next is the quality, which we can document by the grading scale. So in finding the heart rate of our patient, we have different arteries to locate para mabilang natin ang heart rate ng patient. So here is the temporal over here, carotid over here, brachial over here, and radial over here. So sa lower extremities naman, we have the femoral, the popliteal, and the posterior tibial. So use the index finger and the middle finger to count the heart rate of the patient. Do not use the thumb because our thumb is may sariling pulse ito. So tatamat ma'am alam ti heart rate mo. So tatay alak ti pulso. for the respiratory rate. Normal respiratory rate is 12 to 20 cycles per minute. One inhalation plus one exhalation is equal to one cycle. And then we will also look for the depth that can only be done by the use of the accessory muscle and by the movement of the chest. And we need to also check for the rhythm. Is it regular or irregular? We need to count for 30 seconds, and that means the patient has a regular breathing. However, if we found out that there is irregularities, then count for 60 seconds. And that's the reason why I move my patient's forearm na malapit sa kanyang chest. And while ginagawa yun, nilagay ko yung other hand ko sa kanyang likod and check for the deep or shallow breathing. And last step is to get the blood pressure. So first thing in getting the blood pressure, that we need to make sure that our patient is comfortable and their hand is at the table at the level of the heart. Si tilas nga brown ta ma'am kat alam pati PPM. So napahintay mga. And that would be all for my demonstration. I hope you learned something today.